Assalamu alaikum ji. We all know that diabetes has become a menace in Pakistan in particular and in the world in general. And the way it is expanding right now, we are the number one country in the world as far as the prevalence of diabetes is concerned, type 2 diabetes, and it's increasing because of our uh, bad lifestyle, poor hygiene, poor diet, sedentary lifestyle. So Pakistan is one country in the world which should have all kinds of medications fighting against the menace of diabetes. We have sulfonylureas, we have bigonides, we have gliptins, we have insulin, we have GLP-1 receptor agonists. But as a cardiologist, the first and foremost important drug in my armamentarium when I treat patients with type 2 diabetes is SGLT2 inhibitors. And as far as the excellence of diabetes management 2026 is concerned, now SGLT2 inhibitors slash GLP-1 receptor agonists have superseded metformin as the topmost drug in the management of type 2 diabetes. So we should have all kinds of SGLT2 inhibitors because of their cardiovascular protective effects, because of their renal protective effects, because of their beautiful myocardial energetics and increased adaptive response to the RBC mass enhancement because of increased oxygen supply. So we should have all kinds of SGLT2 inhibitors available in the market, in Pakistani market especially. So we do have empagliflozin, we do have dapagliflozin, but what we were lacking was the SGLT1 blockade in addition to SGLT2 blockade, because we all know that SGLT1 receptors are present in intestines, and when these receptors are blocked, there will be lesser spike in the blood sugars because of decreased intestinal absorption of glucose. So there is we are very it's an immense pleasure to announce that we finally have a drug which is SGLT1 and SGLT2 receptor blocker in the market in Pakistan by the name of sotagliflozin. It's again combined SGLT1 and SGLT2 inhibitors, and it has shown good results in clinical data, and one of the largest clinical trials which was published in New England Journal of Medicine, in which initially more than 19,000 patients were screened, but eventually almost 6,000 patients were put on sotagliflozin and followed up to 18 months, which clearly showed that there was a reduction in the primary endpoints of MACE, major adverse cardiovascular events, including cardiovascular fatalities, as well as non-fatal stroke, non-fatal MIs, and most importantly, decreased ER visits because of heart failure and decreased heart failure hospitalizations. So these three characteristics put sotagliflozin to the very top in the armamentarium of treatment of diabetes, especially in patients with chronic kidney disease and coexisting cardiovascular disease. This trial addressed those patients who had an estimated GFR between 20 ml per minute to 60 ml per minute. That is, all those patients who were included in this clinical trial had underlying chronic kidney disease. So this trial was superior to the placebo when it came to the reduction in MACE and all-cause mortality, and patients who had the reduction of heart failure hospitalization and decreased frequency of ER visits because of frank heart failure. So it gives me a pleasure to announce that this drug is finally available in the market, and I'm sure that this drug is going to result in value-added addition benefit in our patients with diabetes, CKD, as well as heart failure. Thank you very much.